Well, our first focus on the show today, Maharashtra on Sunday recorded over 4,000 COVID cases after a gap of 39 days, while Mumbai reported over 600 cases after exactly a month. With the number of cases now seeing an upward trajectory for the past couple of days, around 4 to 5 days. Now, experts have been alarmed over how the cases are increasing. Well, to talk more about this, we're joined by Dr. Rahul Pandit, Director Critical Care Fortis Hospitals Mumbai and member of the Maharashtra COVID Task Force. Dr. Pandit, your reaction to these numbers going up after a month, over 4,000 cases reported in Maharashtra?
Look, it is very, very alarming and concerning. There is no question about that. The Mumbai cases, I have some understanding of why they have gone up. So there have been a couple of reasons which I can easily say. One of them is obviously the local trains have started up. So there is a population which has increased, which is now traveling through the locals, which they were not doing before, say, 4 weeks or so. And that certainly has affected a little bit on the numbers going up. The second, which I am seeing in my hospital, is that I am getting people who are between 60 to 80 years of age. And they seem to be the majority of people who are getting admitted right now. And I believe that these were the people who were actually very, very cautious in the initial part of the pandemic and were staying at home and have now started to sort of go out of their home for various reasons and are probably getting affected, infected, and then getting admitted to us. And the third and the most alarming thing is that people are not really adhering to the corona-appropriate behavior. Social distancing, masking up, and hand sanitization doesn't seem to be the norm in the society right now as much as you would like it to be. It certainly has gone down significantly, and I think that has been the single most important reason why we are seeing the cases to be rising up again in Maharashtra and Mumbai.
Right, Doctor, and this is so worrying because, what we're already seeing in the UK, in the US, Europe, etc., we're seeing cases in India going down. So it's very it's a big relief if, cases going down in India and cases while we're seeing them increase in other countries. But at the same time, as you said, if we leave that COVID appropriate behavior or COVID culture that we'd adopted over many months, we possibly could see that second wave, which we were hoping to avoid.
Absolutely. I think that's the real threat, that if we don't mend our ways now, and that now, when I say now, we need to basically go back to what we were 4 months ago, 3 months ago, be very, very vigilant about our culture, which is what you just mentioned. And if we don't put this rise in the cases, plug them off now, we will actually be at a risk of having a second big wave or a third big wave, whatever number you can give to that. But the bottom line will be that if that happens, then we will be going back towards mini lockdowns or, night curfews and stuff, and which will be actually hurting us even more than what it did 4 or 5 months ago.
So right now, what can authorities do? Track and trace and highlight areas which are seeing the most surge in cases? There are various in Amravati, in Pune as well, Nashik, we're seeing cases going up. So what can authorities do there?
So the 3T approach which has to be there, which is test, trace and treat, has to be the number one approach. We need to keep on testing more and more. Behind one positive patient, we need to do a tracking of at least 18 to 20 people and do their testing so that we are able to actually have a wider net and we'll be able to catch up people who are positive and ask them to be quarantined or treated as per their symptoms and as per their severity. That's the first thing they have to do. And we have to start fining people again for not being having corona-appropriate behavior, especially the mask in the public places. And they need to be aware that if they don't wear a mask, they will be fined. Just like you are aware that you need to stop on a red traffic light, people need to be aware that we need to be wearing a mask. Otherwise, there will be a fine imposed on them.
Right, and especially vulnerable people, as you pointed out, the elderly need to, be more cautious, especially when moving around, given that the impact this disease has on them. Thank you so much, Dr. Rahul Pandit, for speaking to us here at NDTV.
Thank you very much. Thank you.
Now, with Maharashtra seeing an increase in cases, but overall in India, COVID cases have been going down. They've been in decline. So is the pandemic firmly in retreat, or is it too soon to say that? Currently, if we look around, while we remain home to world's second largest COVID outbreak, life in India is almost back to normal, as I was just discussing there with Dr. Pandit as well. Now, to talk more about the India puzzle, the reasons that we're seeing the cases overall going down, we're joined by Professor Bhramar Mukherjee, a professor of biostatistics and epidemiology at the University of Michigan, who's been also closely tracking the pandemic here in India as well. Thank you so much, Professor Mukherjee, for joining us. So what is your view on the reasons that that India is seeing cases coming down? There have been so many different theories given. What is yours?
Yeah, I think that's the million-dollar puzzle, Gargi, and I wish I knew the answer. I think there are lots of plausible hypotheses right now, but we need more data to draw any causal conclusions. So I think that some of the hypotheses that have been postulated in terms of cross immunity, in terms of genetics, in terms of hygiene hypothesis, as well as younger population, they all possibly have contributed to this decline. But I think the most reasonable assumption is that in the metro areas where we have data that the serosurveys show that nearly 1 out of 2 people have been infected, though they were asymptomatic. And this we stated in a paper back in August that most of 98% of India's detected infections are actually the undetected infections. There's a large number of that. And so that saturates the metros. But I am really puzzled about rural India because the serosurveys, statewide serosurveys and national serosurveys also show that the seropositivity or seroprevalence is 10% in some of the remote areas. So why the virus did not spread in the remote areas? And I think the outdoor lifestyle, the aerosol transmission was probably prevented by the outdoor lifestyle of rural India. And there will be other hypotheses as well. So I think that it is a mystery that we are going to dig into for a couple of years to come and even more.
And what's worrying is, like the situation in Kerala right now, in the initial months, the pandemic seemed to have been controlled there. The cases had come down. But once again, in Kerala, it's very high if you compare to other states. So that's one of the areas which is a big worry. What's your view on that?
Yes, I think that, again, we wish that we knew all the answers, but I think that this is a lesson that we cannot really let our guards down. So Kerala did a very good job in terms of controlling the pandemic in the earlier part. But again, it's human nature, and it's also the nature of policymakers and the whole system that we let our guards down. We become complacent. So we still have to wear masks. We have to still maintain social distancing. We have to manage it like an endemic till the vaccine kicks in, because I think we are in this for a long haul. None of us expected last March that it is going to go on this long. But again, throughout 2021, we have to learn how to manage it. And so, and also I'm interested in the serosurvey results for Kerala to see that, probably like Mumbai or Delhi, where we have seen seroprevalences of around 50-60%, Kerala has more room for the virus to grow. So that sort of tells us the lesson that we have to be like New Zealand, that unless the virus goes down to single digits and we can contact trace and contain those cases, we can never let our guards down.
And currently we have the vaccine drive, which is proceeding in India. In March, it will open up for the, second segment of that vaccine drive. But with the cases going down, people are even asking whether, they even need to take the vaccine.
Yes, so that is a question even my parents are asking, that the case counts are down, it's not serious, should we take the vaccine? So my advice consistently has been that even if you had COVID, and in US, the recommendation is that you should take the vaccine. If you had it more than 10 days ago and you did not take a monoclonal antibody treatment, then you should take it. And even if the asymptomatic infections are large and you have antibody positive, the guidelines are that you should not really rely on this ephemeral disease-induced immunity. You should really, the vaccine-induced immunity seems to be really stronger, and new data is very encouraging that it does not just protect you against severe disease, it also reduces transmission and the chance of infection, and that's huge and goes a long way in stopping this virus. So I think that we have to really do the right messaging that all the vaccines, there are some doubt about some vaccines in India, I know, but the AstraZeneca vaccine and Covishield that has data all across the world, and I think that when your turn comes, you should take it.
I wanted to ask you about the variants as well. There are these different variants that have been discovered in the UK, in South Africa and Brazil. It's been very, very alarming. So what more can we expect on this?
Yes, so it is natural for a virus to mutate. And there are many conflicting stories about how lethal this B117 variant is and other variants are. It's definitely true that it seems from the UK data that it is much more infectious. But I think that the old virus, the old strain of the virus, is probably protecting us against the new strain as well. So I have not heard many reports of reinfection of people who were infected with the original variant. And that also gives us hope that the vaccines are also offer some protection and generates immune response against this virus as well. So I am not overtly concerned because we have learned how to manage it. The original, 1 year ago, we are taken aback and we lost our battle initially, but now we have a lot of tools in our armor to fight the new variant as well. And it also shows that we cannot let our guards down. Even when we are vaccinated, probably we're going to wear our mask and socially distance, avoid large gatherings for a long time so that we are confident that we are controlling the virus. So, and again, I think that in India and other countries where the seroprevalence in the big metros are high, probably there is this virus circulating. We should consider like genomic surveillance, but I think that the infection from the original strain is probably giving us some protection as well.
All right. Thank you so much, Professor Mukherjee, for joining us there. In fact, our next focus on the show is about the variant. And now the coronavirus variant that's originated in the United Kingdom is likely deadlier than the original strain. This is according to a new assessment which was released by the British government scientists. In this report, which evaluated multiple studies, the scientists estimated that the strain known as B117 could be 30 to 70% deadlier than the original virus. But they also said there would be a need for more extensive studies. Well, to talk more about this, we're now joined by Professor Sanjeev Krishna, a professor at the St. George's University. Thank you so much for joining us, Professor. So tell us about this new research that has found that the variant in the UK is likely to be even more deadlier. We always knew it was more infectious, but now they're saying it could be deadlier, but at the same time saying that there need to be more studies to say this categorically.
Yes, I think we're always in a process of learning as quickly as we can about the characteristics of this virus and when it changes the variants. And I think early on it was becoming clear that this virus was transmitting more quickly, but that it wasn't clear at the time that it might be causing an increased risk of harm as well. Now, whatever information is coming out, I think this sort of conclusion does take a little bit of time to become firm. I guess what we can say is that the virulence, the effect of the virus on the patients who have it is either comparable to or maybe more than the very original variant. But let's not forget, there's more than one variant now, and in different parts of the world there are many other variables that also affect outcomes from the infection. So it's not easy always to be categorical, as you've implied.
Right. Now, earlier a UK expert also said that the variant found in the UK is likely to sweep across the world. Quite an alarming statement.
Yes, well, as well as everyone, that in the UK we're now very much in vaccine versus virus. And if you take other measures, and the one thing we can say about, I think, the variants that transmit more easily, and that is that we will need the full toolkit of control measures in addition to vaccines if we're really going to succeed in controlling this virus. And if you take the whole collection of measures, at the moment it does look like at least the Pfizer-BioNTech vaccine, for example, does have efficacy in reducing complications with even some of the variants. And so this is still encouraging news, but we have to use these tools all together. We can't just rely on one tool, because if there is increased transmission, then we need added efforts to control the infection to get it below, to get that R value below 1.
Now, if we talk about the vaccine program, UK currently has 3 vaccines that are being used in the vaccine drive, and it's moving steadily. Are there any other vaccines that are looking promising right now?
Yeah, that's a that's a very important question. Not just, of course, for the UK, but for every country that needs vaccines, and that, of course, is every country in the world, because as we've heard so many times now, no one is safe unless everyone is safe. So when it comes to the vaccines, what we've had great success with is, of course, the mRNA vaccines, which are a new type of vaccine. You've got the DNA vaccines, for example, the Oxford, the AstraZeneca one. And then you've got the more sort of old-fashioned vaccines, which would be either the protein vaccines, the subunit vaccines, or virus which has been weakened, so it doesn't cause the same infection that the original virus does. And all these varieties are being developed quickly and are being tested. And some of them are looking better overall than others, better tolerated, maybe have better efficacy, but really they're all part of this global toolkit that we need to be applying very, very effectively to try and control this infection.
So currently this, race for the vaccine drive over the virus, is there any indication when the lockdown will be lifted?
It is a race of vaccine and virus, but it's also, an issue of data and not dates. And that is one of the key messages that I think anybody looking at the response of the virus to lockdown, for example, and vaccines would be saying at this stage. And in fact, even the politicians on whom there is this enormous pressure to, often by other politicians, to come to an answer, they will also be saying the same thing, because it is a fast-moving picture. And even if infections are coming down, the biggest risk that everyone really doesn't want to incur now is that you may have to go into a further lockdown. And that would be an absolute disaster, of course, at all levels, economy, people's lives, and so on. So when measures are being lifted, then I think they must be, of course, lifted very carefully. And everything should be monitored in terms of the response of the infection before you move on to the next measure. Now, this may not appeal to some people, this message that things have to be done gradually, things have to be done carefully, and they must be monitored. But unfortunately, this isn't about politics and what would suit some members of one party or another. It is very much about making sure we don't need to go into lockdown again.
All right, Professor Krishna, thank you so much for speaking to us. Always a pleasure.